there, my name is Kaylee, and in today's lab, I will be doing lab skill 10B, subcutaneous injection for insulin. We'll be using the Humulin R. First, I will wash my hands. Then I will take my MAR and my doctor's orders and compare them to ensure we have the right patient, which is Roger Stevenson, the right medication, Humulin, the right dose, which is 12 units, so 0.12 ml, right time, which is 8 a.m., and as well the right route, which is subcutaneously. After we check that and ensure that they are both the same, we will then do our 5 checks, our 5 writes and 3 checks. So I will first grab the medication. Go into my medication drawer and I will grab the insulin Humulin R. I will then do my first check with the 5 writes. So first check here, so we have right patient, Roger Stevenson. We have right medication, Humulin R. We have right dose, which is going to be 12 units. The right time, 8 a.m., and the right route, which will be subcutaneously. After my first check is done, I will now prepare my medication. So I will take my alcohol swab. I will swab the top here, ensuring that it is clean. I will then take my insulin needle and I will rainbow it open. Perfect. We are going to be giving 0.12 ml today, so 10, 11, 12. And we want to ensure that we first inject air into the vial here. The exact same amount that you will be drawing. So now I can draw the medication. So we're going to be getting 0.12. We want to ensure to go slow so we do not get any bubbles into our medication or into our syringe here. 11, 12. Perfect. After that, we will pull it out, place this down here. I will then scoop up the lid or the cap, place it back on. We then want to make a label. So for this video, I've already made a label with the patient's name, the medication, the dose, the time, the route, and as well I have initialed it with my own initials. I will then peel the label off. Okay, peel the label off, and we want to place it under the amount. We don't want to place it over because we won't be able to tell how much we're giving. If I had a buddy nurse here, I would then show my nurse to ensure that they will check it as well so that I have the right amount, and they would check that for me. After that, I will then do my second check and the 5 writes once again. So we are going to be doing right patient, which is Roger Stevenson, right medication, Humulin R, the right dose, which is 0.12 ml, right time, 8 a.m., and right route is subcutaneously. After that, I will place everything that I'm going to need today onto my medication tray. So we're going to need an alcohol swab for the patient to clean them, a cotton pad, and as well the medication, obviously. We will then bring our MAR with us and we will head to the patient's room. Once entering the patient's room, we will put everything on the bedside here. And we're going to do our third check, 3 writes. So really quickly, we're checking the medication one last time. So we have the right patient, Roger Stevenson, right medication, Humulin R, right dose, 0.12, right time is 8 a.m. on both, and right route subcutaneously on both. After that, I will wash my hands. I will walk into the patient's room, ensuring that they have privacy. Bed is in the lowest position, side rails are down. I will introduce myself. Hello, my name is Kaylee and I will be your nurse today. I will then check 2 identifications on the patient. So can I get your first and last name, Roger Stevenson, and your date of birth? Then as well, I will ask them 3 questions for LOC. So do you know where you are? Face at the hospital. Do you know who I am? You're a nurse. And do you know what the date or time is today? Perfect. So I would say that the patient is alert and orientated to person, place, time itself. Now I would explain to the patient why I'm here today. So the right reason. Today your doctor has ordered Humulin R for the insulin that you will be getting today to manage and control your hyperglycemia. So the right education would be some side effects you already know, maybe hypokalemia, swelling, or erythema. If you experience any of these, just let us know and I will be right back to come help you with that. You do have the right to refuse, so at any time you don't feel comfortable taking this medication, just let me know. So do you feel comfortable with this today? Perfect. So the patient is comfortable, so I will be then doing the right assessment. So for this patient, again, we will lift up we want to make sure the patient is in the right position. So I will lay them down and make sure they're comfortable, expose their stomach area, and we want to clean the site that is 2 centimeters away from the belly button. So find their belly button and 2 centimeters to the side of it is where we'll be cleaning it. So I will then take my alcohol swab and clean the site. So for right assessment, we want to make sure that there's no lesions, no edema, no bruising, nothing that will alter this medication today. Then I will take it, once there's no alterations, no abnormalities, I will then clean the site. Let that dry. Throw the alcohol swab in the garbage. I will take my Humulin R and I will let the patient know that they may feel some stinging, but it'll go away very fast. As they know, they're probably used to this. Never assume though. And then we will rainbow it open. Place the cap there. For subcutaneous, we want to pinch the skin and insert at 90 degrees. And then inject the medication. Take it out at the same angle you put it in. We want to scoop the needle back into its place. I will then place the cotton pad on the injection site and hold pressure there. I will check if there's any bleeding. If so, tape the cotton pad. If not, throw the cotton pad in the garbage. I will make sure that I throw all my sharp objects into the sharps, everything else into the garbage. I will then make my patient comfortable once again, leaving them in a comfortable position. And I will then give them the right evaluation. So letting them know that I will be back in about 15 minutes to come check up on them. And if at any time before then they feel any side of adverse effects or anything like that, they can just ring their call bell and I'll be right back to help them. As well, I will document that I have given them Humulin R on my documentation medication sheet by signing my name. And then I will let the patient know, ask them if they have any questions about anything else, make sure they're comfortable, provide privacy once again. The side rails are now up, bed is in the lowest position. I will then wash my hands. As well, in the beginning, I did forget to ask them for any medication or any allergies. So before administering any medication, make sure you do those things.